Distinguished panel, ladies and gentlemen, David, thank you very much for the invitation to be here and give this pitch. My name is Sebastian Bauhoff, and as David said, I'm a research fellow and health economist at the Center for Global Development here in DC. When David asked me to pitch this topic, he suggested I talk about efficiency, and I decided, maybe not like a researcher but more as a politician, to just call it value for money. This seems more catchy. So in the next few minutes I will try to convince you why I actually didn't need any convincing that value for money should be the topic for next year's forum. And I think when I'm done, you will agree with me. So first off, let me explain what I mean by value for money. I mean really getting the most benefits out of our resources. That is by allocating more efficiently, by generating more impact, or by cutting costs as appropriate. This is not just about countries and programs, but it's also about international agencies and donors. Getting more value for money is important for two reasons. First, within the health sector, resources are pretty scarce, and we should make sure that we spread them as far as we can to save most lives and decrease morbidity and make most health gains, including equity gains, as my subsequent speaker, Larry, will argue, I think. Across sectors, there's competition for resources and for the attention of policymakers that is also very scarce, and we need to make sure that health stays on top of the agenda. And we do this by showing to citizens and to decision makers that our sector, health, can actually provide value for money. This is more important today than ever before. Global economic slowdown is likely to continue and will put pressure on budgets of governments. Development assistance has already been flat for the past 5 years and is unlikely to recover at any time soon. And at the same time, we've made substantial progress and also commitments as part of the UHC agenda. We need to protect those gains and enhance them further. Increasing and demonstrating value for money, I would argue, is a good way to do that. Let me give you some examples of value for money in the three financing functions that David already mentioned: revenue raising, pooling, and financing, purchasing. And contrary to what David said, I do think that we should talk about those with efficiency or value for money as a cross-cutting issue. So with regards to resource mobilization, we already heard at this forum many people arguing for the need to be more efficient. That includes developing tax systems that reduce distortions, broadening the tax base, and particularly at intersections like the formal and informal sector, being careful of what incentives we create. It also means to better leverage the private sector to make government spending and donor assistance go further. With regards to pooling, there is large scope to improve efficiency. For example, reducing the fragmentation of risk pools can not only improve risk protection, but also reduce administrative costs. And it helps avoid some unsavory incentives that come along with multiple risk pools that require a lot of regulation, for example, against risk selection. Colombia, if you have followed that, is making substantial efforts and expending a lot of money on equalizing risk across as many health plans to avoid risk selection issues. So this is a very topical issue. Within purchasing, there's a huge room to get more out of the money that we currently spend. As with revenue and pooling, the key here is to get the institutions and the incentives right. And that's not an easy task. One option is to reform payment systems to orient them more towards results. And evidence from Rwanda and Argentina suggests that results-based financing might be one promising way of doing this. Both aligning the incentives to encourage performance, but also making sure that the money we put into the system arrives at the front lines. And I would argue that these kinds of issues, the purchasing function being efficient about it, are also highly visible to citizens, and that's why they're important for the buy-in into our agenda. But even within results-based financing, there's huge room for improving efficiency, for example, in reducing the costs for routine verification and other kinds of functions that are necessary. We also need to be much smarter about orienting our benefits plans to cost-effective treatments. And any money we can save in weeding out the ineffective treatments and allocating to more cost-effective ones can potentially have a big impact on health outcomes. The one item I would add to this list is data. We also need to be much more efficient in this area. And instead of calling for more data, we should really think about how to make better use of existing data and data systems. UHC programs generate a huge amount of administrative data that is often wasted and not put to good use because it is messy and difficult to access. And as a result, our data are not used to their full potential. And these data are already available. And at the same time, we also collect a lot of unnecessary data, and they are costly to collect. So we should cut back on that as well. And I think overall, data is really a low-hanging fruit that we should spend a lot of time talking about. As you can tell from the examples that I gave for the financing areas, getting value for money in health is not easy. It's a complicated task. But we're lucky that there are many success stories and new initiatives that tackle this issue. The Joint Learning Initiative and the Global Financing Facility are two, and I would suggest that we use the next forum to follow up with their work and their progress, and also to learn from one another. So let me close by reiterating that in today's environment, increasing and demonstrating value for money is not optional anymore. The competition for limited resources is heating up very quickly, and if we want to make sure that we lock in the gains and the momentum from the UHC agenda, we have to focus on value for money. Thank you.